Hey everyone, my name is Don. I'm a general surgery resident, and today I wanted to talk a little bit about choosing a specialty and how I personally chose general surgery. So, when I started off, I honestly didn't want to do surgery at all. I was actively avoiding anything surgery related because, in my mind, surgery was very tough. It was long hours compared to others field in medicine. And honestly, going into medical school, I talked about this in another video, but I had all these technical skills and I loved learning with my hands and learning new skills. But I found that I had all these hobbies. Why would I want to make it my job to use my hands? And then outside of that, maybe I wouldn't want to do all my hobbies when I got home if I had used my hands all day. Honestly, a lot of people told me, you do magic, you crochet, oh wow, you'd be such a good surgeon, kind of jokingly, but they knew that I had an interest in doing things with my hands. So to them, I just looked like someone who would be a great surgeon. And I never really saw it that way. I didn't really understand how technically difficult the surgery was. In my mind, it sounded kind of just a bit, not necessarily easy, but not the technically challenging aspect that I liked when I was learning magic and learning crochet. And coming into medical school, I wasn't really exposed to anyone who was in surgery. And so the picture of the surgeon I had was the one that everyone had, kind of the big ego who wanted everything done their way. I really didn't associate with the big ego that surgeons were portrayed to have. And I just didn't think that I needed that kind of control in my career to be the person to cure people with my hands and save people's lives tangibly. And not to say that that's what I need in my career now or that aspect of myself has changed, but it's more that I learned to see surgery and surgeons in a different light, having met more people, and I've been able to associate myself and see myself doing a similar career to a lot of surgeons that I look up to. The first example of that in medical school was when I did a rotation in second year. At the end of second year, I did pediatric surgery and I got to meet a pediatric surgeon who was probably one of the people I look up to the most and who inspired me to pursue surgery at first. The relationship I developed with the surgeon over the course of the 2 weeks is really what started my interest in becoming a surgeon and in surgery itself. And when talking to classmates about how they chose a specialty, that's a common thing that comes up too. It's not really the anatomy, the science, or the medicine of the specialty that interests someone the most. It's really when they meet mentors and people they see themselves in or see themselves doing the same thing as a career that inspires us to pursue this specialty. And I really think that during my clerkship as a medical student, that's how I reinforced what I wanted to do, is that I met more and more people that I found I could associate with and who were passionate about their jobs the same way that I could see myself be passionate. So when I finally started clerkship and doing rotations in the hospital, I found myself to still be very open-minded about what I wanted to do. I knew that surgery was very interesting, but I kept an open mind to see what else I could be interested in, and also just so that I could perform well in each specialty and not kind of be too focused on a single specialty and not see everything that a certain rotation has to offer. So the beginning of clerkship to me and to a lot of people too serves to rule things out as you're progressing through these rotations that are mandatory. I find that you initially learn a lot more about what you don't like. I actually liked every rotation and found something enjoyable in each of them and saw how someone could be passionate about this. But looking back on things, I think I enjoyed a lot of the rotations because it was still new clinical experience and I enjoyed seeing patients finally kind of working towards being a doctor, learning more medicine, and a lot of that biases your choices a little when you think about rotations back, because it's tough to know what is just doctor stuff and that you enjoy and what is specialty specific that you cannot find in another specialty. And so slowly during my third year of medical school, I was more and more sure of my choice of going into surgery. I wasn't sure which surgical subspecialty I wanted to go into, but I knew that I wanted to do something surgical at least. And that is really because of the operating room. When I was in the operating room for obstetrics gynecology, for example, I found that time went by so fast. I was so focused during the operations and I found that nothing made time go by faster than being in the OR. And it reminded me a lot about the hobbies that I learned when I was younger, whether it be crochet or magic. And I would spend hours and hours practicing that at home, and I wouldn't eat, I wouldn't really sleep. I would stay up till 5 a.m. to complete a project. I would just be completely absorbed by what I was doing with my hands. And I found it to be very similar when I was in the operating room. So by this time, I knew that I wanted to be a surgeon, but I had to ask myself, was the rest of it worth it? Was the long hours worth it? Was what I was going to do outside of the operating room worth the operating room time? And I told myself the only way to know is to do a lot of these rotations. And so I booked all my electives, which are rotations that we choose based on what our future interests are. All my electives of fourth year, I booked them before even doing my core general surgery rotation in third year. I kind of gambled a little there. I knew that I was gonna like it, and I had to do it a bit early because or else you are limited in your choices and you have to plan really ahead. So to me, general surgery seemed like a very logical choice of specialty rather than the other subspecialties of surgery. And the reasons I like general surgery a lot is for the diversity of cases, of anatomy, and of procedures. So you basically cover cases that are from the neck down to the pelvis, excluding the heart, and you can do procedures that are life-saving or small procedures that are more cosmetic, more relating to the skin. There's also a lot of oncology involved, and so you get to deal with that whole aspect of medicine that is dealing with cancers. And across all surgical specialties, there's the team management aspect of it. As you go up in the ranks of residents, you gain more responsibilities and you oversee more junior residents, and you always work in a team to improve the care of patients. And so I knew that I wanted to be part of a team and not just kind of work alone. But honestly, all of this would almost not be worth it to me if general surgery didn't have laparoscopy. To me, that's one of the biggest reason, if not the biggest reason, that I'm doing general surgery. It's because I love minimally invasive surgery. I love seeing it. I love the technical difficulty of it. It's really with laparoscopy that I realize how technically challenging general surgery can be. And it's something that I want to master. I told myself that if I were to go the rest of my life without having learned laparoscopy, had I done another specialty, I would think I would regret it. I think that I wouldn't be okay with myself not at least trying to learn laparoscopy, because in the same ways that I liked all these technical hobbies and manual crafts, I just instantly connected when I saw laparoscopy for the first time, and when I got to hold a little bit the instruments and help out during surgeries, I instantly knew that it was for me. There's also this small point that was in the back of my mind when applying, is that there's more spots for general surgery across the country when you're applying. So the subspecialties tend to be very small programs in each school, and they're quite competitive. And so being late to the game and knowing I only wanted to do general surgery in basically end of third year and fourth year, I knew that I couldn't build a competitive profile to compete with all the people who wanted the subspecialty surgeries for a long time. And that's not to say that it's impossible to match to a subspecialty surgery when you're late in the game, but I knew that just by numbers, general surgery was the easiest way to become a surgeon at that time. And honestly, even if I'd known that I wanted to do surgery in first year, I don't think I would have chosen any subspecialty like plastics or urology or ophthalmology. I really think that general surgery matches my personality the most, given that it hits a wide variety of anatomy and procedures, and there's always something to learn, and I think it'll take a lot of time to master all of it. And so that's how I decided on general surgery. I personally think that it's the best specialty for me, but I understand that it's not something that is for everyone, and I really don't go around recommending that to everyone. There's a lot of pros and cons that are involved in choosing a specialty, and to me, the cons of general surgery, which I didn't talk about much, are definitely outweighed massively by the pros of what I love about it. And so if you're a med student and you're looking into choosing a specialty, my advice would be to look at staff and also look at residents in that specialty. Because being a staff is what you're going to be later on. You have to be okay being a resident for 4, 5, up to 7 years even, and if you don't enjoy being a resident, then you probably won't make it through. Honestly, residency is going to be hard across the board, not just in surgical specialties, so you have to find if the pros outweigh the cons for you. But with that being said, you have to keep in mind that residency doesn't last forever, and the staff position is the career you're aiming for in the end. Another thing to consider too is that within a single specialty, there are thousands of different careers depending on what you want to do and what your different goals are. So just because you see someone doing that doesn't necessarily mean that you would end up doing the exact same thing. To a certain extent, you can always make it your own, and based on your interests and your values, you can always adapt your practice and your career to this. There's a lot more to consider than just if you like that specialty and if you're okay doing those hours, because there's going to be a lot of pros and cons to think about, and somewhere you're going to have to compromise. And sometimes people compromise with their careers, even in medicine. And that's okay if you know what your life goals are and that you're happy doing what you're doing in and outside of medicine. So basically, that's how I chose general surgery and my thoughts on choosing a specialty in medical school. I hope that this was interesting and helpful. Some of these tips are obviously my personal opinion. I want to thank you guys for watching, and I'll see you guys in the next one.